Assalamu alaikum wa rahmatullahi wa barakatuh. Let's summarize what's covered in the previous topic. We said that healing process is formed either by regeneration or by scar formation, or what's called connective tissue laying down. Regeneration occurs if the type of cell is either labile or stable, and we gave examples of this. Also, it occurs when the injury is minor, so no affection of the extracellular matrix or the basement membrane. However, in scar formation occurs when the type of cell is permanent or there is affection of the extracellular matrix or basement membrane, as in cases of severe injury or chronic injury, like chronic inflammation. So follow the rule. Labile cells, like in bone marrow, for example, there is blood loss or consumption. Actually, colony stimulating factor lead to renewal of hematopoietic cells. Colony stimulating factor is released by blood elements when there is loss of some of them. Stable cells, like in hepatocytes of the liver, actually when we remove or resect a part of the liver, even up to 60% of the liver, there is no affection of the extracellular matrix. There is no inflammation or there is no destruction, and the cells are stable. So there is stimulation of proliferation. Again, the proliferative activity of the remaining part of the liver after resection, there is regeneration after surgical removal, up to 60% of the liver, without scarring, because there is no affection of the extracellular matrix. Well, I have to emphasize that this occurs only if the residual tissue is structurally and functionally intact. There is no affection of the basement membrane or extracellular matrix, as occur in inflammation. So, if inflammation occurs, incomplete regeneration plus scarring. Repair by connective tissue. So, this is when we call for connective tissue for laying down. The previous slide was on regeneration. Repair by connective tissue occur again if severe or chronic destruction of the basement membrane or extracellular matrix or damage of a permanent type of cell, like in brain or heart. Well, tissue repair is controlled actually by biochemical factors and mediators released in response to cell injury. We just talked about one of them, which is colony stimulating factor in case of bone marrow loss. Yes, this factor is triggered by in response to cell injury or blood loss. Again, in response to cell death or mechanical trauma, like hormones, cytokines, and growth factors. What are the functions of growth factors? What are the actions of growth factors? Actually, they promote cellular proliferation. Again, cellular migration and differentiation, enhance synthesis of specialized proteins, promote the function of growth control genes. Yes, we need the cells to migrate to cover the gap formed by inflammation or by injury. We need the cell to differentiate in order to get a fully mature and to restore function of the tissue. We need the cell to proliferate in order to cover all of the gap formed by the injury. And we need synthesis of specialized proteins for the newly formed cells for the enzymatic activity required in healing process. We need also to promote the function of growth control genes, because growth control genes actually is responsible for cellular proliferation. Well, what are the growth factors by name, and what is the source of them, and what are the functions of each of them? The first growth factor or cytokine is called epidermal growth factor. From the name, epidermal is secreted by keratinocytes and in addition by macrophage. They are responsible for mitogenic from name mitogenic epidermal growth factor from name mitogenic for keratinocytes. What is keratinocyte? Yes, it's the cells lining the forming the epidermis, cells lining or forming the epidermis of the skin, for example. Well, the second cytokine is transforming growth factors. Transforming growth factor is responsible for many things, so it's secreted by many cells, like platelets, like smooth muscle cells, endothelial cells, macrophage, keratinocytes, lymphocytes, and fibroblasts. And they are responsible for chemotaxis of all inflammatory cells, like polymorphonuclear cells, macrophage, lymphocytes, fibroblasts, smooth muscle. What are the function of all of these things? We will talk about it later. However, I want you to understand that each one of these cytokines has a function, has its role in the healing process. And I want you to know what is the function of each of them. Regulate integrin, responsible for angiogenesis stimulation. TIMP synthesis. What TIMP? TIMP is tissue inhibitor of matrix metalloproteinase and inhibit here is stimulate TIMP synthesis and inhibit and again matrix metalloproteinase production, stimulate fibroplasia. What else? Platelet-derived growth factor. Platelets, smooth muscle cells, endothelial cells, macrophage, and keratinocytes, responsible again almost for the same things. Finally, vascular epidermal growth factor. From the name, this is vascular, so it's responsible for vascular permeability and angiogenesis. What is the extracellular matrix? We usually say if there is affection of the extracellular matrix, scarring will eventually happen. So what is the extracellular matrix? Actually, extracellular matrix is the frame that support the cells, that keep them in places. Well, you remember the photo that we talked about in the previous session? This is a photo, and this is the frame of the photo. You know, this frame is responsible for holding or keeping this photo in position. So you can hold it on the wall or put it on your desk and so on. It is the same. Extracellular matrix is a dynamic component which form a network around the cells and constitutes a significant proportion of any tissue. What is the components of extracellular matrix? Like in the epidermis or epithelial cells, they are lying on what's called basement membrane. Of course, basement membrane here is to hold the epithelium in place and not to fall down into the subepidermal tissue. This is basement membrane. What is the interstitial matrix? Interstitial matrix present in between cells. You know that there is connective tissue, for example, formed of fibroblasts or blood vessels or whatsoever. There is a delicate framework in between that keep all these structures in place, called the interstitial matrix. Actually, synthesis and degradation of extracellular matrix not only occur in wound healing, but also occur in morphogenesis to keep the organ or the tissue morphology intact, occur in chronic fibrotic process which end eventually by scarring, as we mentioned, occur also in tumor invasion and metastasis, because in case of tumors, the cells are able to invade the extracellular matrix. There is some changes occur in the composition of extracellular matrix that allow the cell to invade them. So these are the forms of intracellular matrix. What are the sites of them? What are the origin and what are the components? We will talk about them. Components of extracellular matrix. This is the epithelial cells, and this is the basement membrane. Look, this is the basement membrane. Well, The basement membrane is secreted by the epithelial cells and formed of type 4 collagen, laminin, and proteoglycans. This is the interstitium, and they are formed by the connective tissue cells. On top of them are the fibroblasts. Well, the components of interstitial matrix are fibrillar collagen, elastin, proteoglycans, and hyaluronan. So basement membrane is synthesized by overlying surface epithelium and underlying mesenchymal cells. Interstitial tissue is formed by the fibroblast. Yes, the fibroblast is the most common cell that creates collagen. And formed of collagen, elastin, adhesive glycoproteins, proteoglycans, and hyaluronan. Well, what is the role of extracellular matrix? Support the tissue and keep them in place. What else? What else? Yes, there are other functions rather than mechanical support. They regulate cell growth, regulate cell proliferation through interaction between them, between the extracellular matrix and the epithelial or whatever type of cells lying in, through cellular receptors of integrin. Number 3 is maintaining cell differentiation via integrin, scaffolding for tissue renewal, basement membrane integrity, establishment of tissue microenvironment as in the kidney, storage and presentation of regulatory molecules, hence rapid use when needed.